Name is Sierra. I've got my Nightingale badge, proper clothing, no nail polish, and my hair is up. I'm going to be doing the skills video on pregnancy education on a healthy pregnancy. So the first thing that we're going to talk about are going to be all of the doctor visits. The first one being in the first trimester, which is week 1 through 12. It's usually at week 4 or whenever the mom finds out they are pregnant. The first visit is the most in-depth one. They are going to do all sorts of things, get your family history, your health history, surgical history, information on previous pregnancies, any risk factors you might have. They're going to get your vital signs, all of them. They're going to check your height. They're going to check your weight. They're going to get blood work done like a CBC, HGB. They're going to do an STD check, a UA. They're going to check your blood type. You're going to get a pap smear. You're going to get a pelvic exam. They are also going to give you your estimated due date. At 10 weeks, they will be able to start hearing your baby's heartbeat, so you'll get to hear it on the fetal Doppler every visit, as well as they're going to start measuring the fundal height. Those appointments are every 4 weeks. And then during your second trimester, it's going to be 13 through 28 weeks. Those visits are going to be, no, 1 through 28 is every 4 weeks. So your second trimester is 13 to 28 weeks. During your second trimester, you're going to have just your regular routine visits. Plus, you will have the option to do some genetic testing. You can do the NIPT testing, which will check for Down syndrome. You can do an amniocentesis or the CVS, which tests for any genetic abnormalities. And you can also get an AFP, which checks for neural tube defects. At 20 weeks, you will have your anatomy scan, and that's when they can pretty well tell you the gender of your baby as well. In your third trimester, 28 to 40 weeks, you're going to have your regular routine checkups. They're also going to recommend the Tdap vaccination. You'll get the RoGam shot if you are an Rh negative mom. You will also do your 1-hour glucose test just to rule out you being having any pregnancy diabetes. Your appointments 28 through 36 weeks are going to be every 2 weeks, and then 36 weeks through delivery are going to be every week. From your appointment after 36 weeks, they're going to still continue to do the routine checkups, but they're also going to check your baby's position. They're going to check your cervix. You're also going to be getting a lot of education on labor, contractions, and what to do should your water break. So moving on to nutrition, you definitely want to ensure that you are having a well-balanced meal that will help support the growth of your baby while keeping you healthy during pregnancy. Although you really only need a recommended of an extra 300 calories per day. You want to have a diet full of fats, carbs, your veggies, your fruits. A good option for iron could be like meats and dried fruit. You could have bananas for potassium. You could have orange juice for vitamin C. Dark leafy greens are a good source of calcium. Supplement recommendations. So you should have, I think they recommend 400 micrograms of folic acid daily. And you also want to take omega-3 fatty acids. Some of the foods that you do want to avoid, you want to avoid unpasteurized milk, the soft cheeses, some of the fish that contain salmonella or a high level of mercury. You don't want any extra salt in your diet. Keep that swelling down. When it comes to exercise, it's recommended that you can have about 2.5 hours a week of exercise, and that is low impact exercising like walking, yoga, swimming. What you do not want to do are any super high impact exercises. You don't want to do anything that's going to put pressure on your baby. No heavy lifting. You definitely don't want contact sports. So weight gain is a little different for everybody. What's expected based off of the mother's BMI. So if you are underweight, 18.5 or lower, it's expected that you're going to gain 25 to 30 pounds as well as a normal BMI, which is 18 to 24 BMI. If you are overweight, which is a BMI of 25 to 29, they recommend you gain 15 to 25 pounds. And if you are considered obese, which is a BMI over 30, it's recommended that you only gain between 11 and 20 pounds. So, moving on, 3 common complaints that you see often during pregnancy is the nausea and vomiting, especially during that first trimester. You can take maybe ginger snacks, some very bland crackers are known to help get up nice and slowly in the morning, maybe even have a couple crackers before you get up. Another one is stretch marks. So there are lots of approved lotions that you can use that are actually made specifically for stretch marks. You can also mix that with some vitamin E for extra moisture, put it all over your abdomen, your breasts, legs, any worry spots. And third, we have constipation. So if you are having complaints of constipation, just try to increase your fluid intake, more fiber in the diet. Your doctor may even prescribe a stool softener, case by case basis. And lastly, some warning signs that you would want to call your doctor's office right away if you are experiencing. The first one is if one of your legs is really red, shiny, hot to the touch, swollen, that could be an indication of a possible DVT. Call your doctor right away, see what they suggest. Another one is if you get a really bad headache, that is one of the signs of preeclampsia, which is a very high blood pressure during pregnancy, very dangerous. And lastly, severe abdominal pain, like lower abdominal pain. It's an indication of placental abruption. That's when the prematurely placenta detaches from the uterus wall. So if you experience any of these, you want to reach out to your doctor's office right away and just see what they recommend. And I think that concludes my teaching for today.